Imagine spending hours each day consumed by thoughts about a perceived flaw in your appearance, one that others can barely see or don't notice at all. This is the reality for millions of people worldwide who live with body dysmorphic disorder, or BDD. Far more than simple vanity or insecurity, BDD is a serious mental health condition that can devastate lives, relationships, and potential. Today, we'll explore the complex reality of body dysmorphic disorder, a condition that alters not just how people see themselves, but how they experience the world around them. Defining body dysmorphic disorder. Body dysmorphic disorder is characterized by an intense preoccupation with perceived flaws or defects in physical appearance that are either minimal or not observable to others. These concerns can focus on any body part, though they commonly involve skin, hair, nose, eyes, teeth, or facial asymmetry. What distinguishes BDD from normal appearance concerns is the extreme distress these perceived flaws cause and the significant impairment they create in daily functioning. For someone with BDD, these aren't passing thoughts but consuming obsessions that can dominate consciousness for hours each day. The perceived defects become magnified in importance, while positive attributes fade into insignificance. This distorted body image proves remarkably resistant to reassurance, with sufferers often convinced that others are simply being kind when they don't acknowledge the obvious flaw. The lived experience of BDD. The internal experience of BDD is one of profound anguish. Individuals describe feeling ugly, abnormal, or even monstrous. This distress frequently triggers intense shame, self-loathing, and isolation. Many report feeling that they're constantly being scrutinized and judged by others, leading to overwhelming social anxiety. The emotional pain can be so severe that up to 80% of people with BDD experience suicidal thoughts at some point, with actual suicide attempts significantly higher than in the general population. This internal turmoil manifests in distinctive behaviors. Mirror checking becomes complex and ritualistic, not casual glances but prolonged scrutiny, often under specific lighting conditions or from particular angles. Conversely, some engage in mirror avoidance, removing or covering mirrors to escape their reflection. Excessive grooming, skin picking, or hair plucking may consume hours daily in attempts to fix or hide the perceived flaw. Camouflaging behaviors become elaborate rituals, strategic makeup application, specific hairstyles, careful clothing selection, or maintaining precise body positioning to hide the defect. Constant comparison to others and persistent reassurance-seeking provide only momentary relief before doubts resurface. Many undergo multiple cosmetic procedures, yet satisfaction remains elusive as concerns often shift to another body part or intensify despite objective improvement. BDD across different populations. While BDD typically emerges during adolescence, a time of heightened body awareness and identity formation, it can develop at any age. The disorder affects people across genders, though manifestations may differ. Males may focus more on muscle mass, body size, or genitalia, sometimes called muscle dysmorphia or colloquially bigorexia, while females more commonly focus on weight, skin, or facial features. However, these are tendencies rather than absolute differences. Cultural factors significantly influence how BDD manifests. In image-focused societies with narrow beauty standards, certain preoccupations become more common. However, BDD exists across cultures worldwide, suggesting fundamental biological and psychological mechanisms beyond cultural influence alone. Causes and contributing factors. BDD emerges from a complex interplay of biological, psychological, and environmental factors. Neurobiological research reveals differences in visual processing and emotional regulation systems. People with BDD literally see differently, with brains over-focusing on details rather than holistic visual processing, and showing heightened emotional reactivity to appearance-related stimuli. Genetic factors play a significant role, with BDD more common among first-degree relatives of affected individuals. There's also substantial overlap with obsessive-compulsive disorder, OCD, suggesting shared genetic vulnerability. Psychological factors include perfectionism, aesthetic sensitivity, and emotion regulation difficulties. Many individuals report histories of appearance-based bullying, teasing, or traumatic experiences that may contribute to development. Sociocultural influences, particularly media portrayals of idealized and often digitally altered bodies, create unrealistic comparison standards. However, these factors alone don't cause BDD. Rather, they interact with biological vulnerabilities in susceptible individuals. Diagnosis and assessment challenges. Despite its prevalence, affecting approximately 1 to 2% of the general population and much higher rates in certain settings like cosmetic surgery clinics, BDD remains underdiagnosed. Shame often prevents individuals from spontaneously revealing their concerns, instead presenting with symptoms of depression, social anxiety, or substance use disorders that may mask the underlying BDD. Compounding this challenge, many seek treatment from dermatologists, dentists, or cosmetic surgeons rather than mental health professionals. Without proper screening, these providers may not recognize BDD, potentially leading to unnecessary procedures that fail to address the psychological condition. Proper assessment requires sensitive questioning about appearance concerns, time spent on appearance-related behaviors, and associated distress and impairment. Evidence-based treatment approaches. The good news is that effective treatments exist for BDD, though recovery typically requires specialized approaches. Cognitive behavioral therapy, CBT, specifically modified for BDD, has shown significant effectiveness. This approach helps identify and challenge distorted appearance-related beliefs, gradually reduce checking and avoidance behaviors, and develop healthier ways of relating to one's body. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, can significantly reduce BDD symptoms, often at higher doses than those used for depression. For many, a combination of CBT and medication offers the best outcomes. It's worth noting that cosmetic procedures rarely resolve BDD symptoms and may sometimes worsen them as preoccupations shift to new areas. More severe cases may require intensive treatment programs or hospitalization, particularly when accompanied by severe depression, suicidality, or extreme functional impairment. Newer approaches like perceptual retraining to address visual processing biases show promise for future treatment development. The impact on life and functioning. The impact of BDD extends far beyond appearance concerns. Many individuals struggle to maintain education or employment, with studies showing rates of dropping out of school or inability to work as high as 30%. Social relationships become severely restricted as individuals avoid situations where they feel exposed or scrutinized. Dating and intimate relationships often seem impossible given the intense body shame. Daily activities most take for granted, shopping, eating at restaurants, attending social gatherings, become overwhelming challenges. The condition frequently leads to substantial financial strain through costs of cosmetic procedures, dermatological treatments, special clothing, or makeup, often paired with reduced earning capacity due to impaired functioning. BDD in the digital age. The rise of social media and selfie culture has created new challenges for those with BDD. Photo-based platforms can intensify comparison behaviors, while filtering and editing tools can reinforce the belief that appearance flaws should be eliminated. The constant presentation of curated, edited images as reality distorts societal perceptions of normal appearance variation. For some with BDD, technology becomes part of symptom expression, taking hundreds of selfies seeking the right angle, or spending hours editing photos. Conversely, others avoid photography entirely, missing family events or removing themselves from group photos. Health professionals now recognize Snapchat dysmorphia, the phenomenon of people seeking cosmetic procedures to look more like their filtered social media images. Beyond the individual, family impact. BDD affects not just the individual, but entire family systems. Family members often become unwittingly involved in accommodating symptoms, providing reassurance, facilitating avoidance, or modifying family activities around the person's BDD. This accommodation, while well-intentioned, can inadvertently reinforce symptoms. Families frequently report feeling helpless, frustrated, or confused by behaviors they don't understand. Education about BDD and family therapy can help loved ones provide appropriate support without enabling symptom maintenance. Learning to respond effectively to reassurance seeking while maintaining compassion represents a challenging but important balance. Moving toward recovery. Recovery from BDD is possible, but typically requires professional treatment. The path isn't usually linear, with fluctuations in symptom intensity common during treatment. Success involves not just symptom reduction, but developing a healthier relationship with one's body and appearance, placing it in appropriate perspective within a broader sense of identity and worth. Peer support can play a valuable role, connecting individuals with others who truly understand the experience of BDD. Developing alternative sources of self-worth beyond appearance, through relationships, abilities, values, and contributions, helps create resilience against appearance preoccupations. Challenging stigma and misconceptions. Despite increased awareness of many mental health conditions, BDD remains widely misunderstood. It's often dismissed as vanity or narcissism, when in reality it involves intense suffering. This stigma prevents many from seeking help, believing they should simply get over it, or that their distress is somehow deserved or trivial. Education is crucial in changing these perceptions. BDD is a recognized neurobiological condition, not a character flaw or choice. By sharing accurate information and authentic stories of those affected, we can create greater understanding and compassion for this challenging disorder. Conclusion. Body dysmorphic disorder represents a serious mental health condition that distorts perception, consumes thoughts, and significantly impairs functioning. However, with proper diagnosis and specialized treatment, recovery is possible. If you or someone you know is experiencing symptoms of BDD, professional help can make a profound difference. Remember that appearance concerns that cause significant distress deserve attention and treatment, not dismissal or judgment. With greater awareness, earlier intervention, and continued research, we can help those with BDD move beyond the mirror and toward lives of greater freedom, connection, and purpose.